There are three sets of major salivary glands. These are parotid gland, submandibular, and a pair of sublingual. So, in case the patient gets parotitis, that is infection of the parotid gland, there is a possibility the infection can aggravate and it may result in abscess formation. So in this video, I'll tell you the causes for that, the clinical presentation and clinical presentation and the necessary investigations to be done, and how we treat such conditions. The common causes for parotitis leading to parotid abscess are poor oral hygiene or decreased saliva production for some cause in the salivary glands, or any surgery, or specifically oral surgery. When the patient is admitted, IV fluids are going on, the patient is dehydrated. These are the common causes for that. So in this case, what happens is, any one of these organisms, either Streptococcus or Staphylococcus, there's a common cause for this. It can produce micro abscess in the parotid gland, and all these micro abscesses, it coalesces together to form a parotid abscess. The commonest complaint of the patient will be, it starts with fever and a painful swelling over the parotid region. On examination, there will be swelling over the parotid region, and the skin over the swelling will be discolor, slight reddish in color, and it will be painful also, it will be tender, and there will be absence of fluctuation because there is a thick covering on top, fascia, thick covering, so fluctuation cannot be elicited properly. Now, when we massage at this area, parotid area, and we examine the oral cavity, there is a duct opening here, Stenson's duct. Pus discharge can be seen coming out from the Stenson's duct, and usually the pus will be collected for culture and sensitivity. Suppose it is just left like that, it can lead to, this infection abscess can spread to other spaces in the neck. Coming to investigation, the necessary investigations are complete blood count along with C-reactive protein and calcitonin, and the reports will show that all these levels are elevated. We can do either ultrasonography or CT scan with contrast. So the second later one, the CT scan with contrast, is preferred. The patient will be admitted, and we'll start with IV antibiotics and analgesics. And once we get the report of CT scan, and depending upon the size of the abscess, suppose the abscess is very small, we'll do ultrasound guided aspiration and give a course of antibiotic for trial run of medical management. Suppose there is significant size of parotid abscess, then we need to do incision and drainage. That's the only way of treatment of the abscess. So this incision and drainage approximately takes to half an hour to 1 hour. And the pus which is collected will be sent for culture and sensitivity as mentioned earlier. The patient will be in the hospital for IV antibiotic at least for 3 to 4 days, and most probably if the parameters are normal, like fever has come down, swelling has come down, CBC, C-reactive protein and chlorocalcitonin, all the levels have all the parameters have started coming down, then it's time for discharge, usually on the 5th day. The patient will be discharged with a course of antibiotic, painkiller for a few days, and along with multivitamins, with advice or wound dressing, which will be going on for a few days every 3rd day. So first review to the main surgeon will be on the 7th day. During this 7-day waiting period, your diet at home will be normal, and you should be active and ambulant, drink plenty of water, and neck movements can be normal. You can have a shower, but take care the bandage doesn't get wet. So this is how we manage a case of parotid abscess. Thank you so much.